I suppose one of the things that the programme for government has committed to doing is a step change in disability services. This is a very welcome and ambitious objective, and should it come to fruition, I think in 5 years' time we will be able to reflect positively and that this government will have a legacy of change in this area should it come to pass, which I think we would all hope that it will. My own professional career has coincided with an era where children with diverse needs began to enrol in the mainstream school setting, and we saw with that the introduction of additional resource and supply teachers, and indeed the introduction of special needs assistants in classrooms and schools throughout the country. And indeed one would have to pay tribute to the current Taoiseach for the role he played in developing and introducing that system. But with that, teachers have become great advocates for children with special education needs, and it has extended the role of the teacher beyond the classroom in terms of advocating with service providers for children within their classrooms and for whom they provide tuition. I also have to say that I have been fortunate in my teaching career to work with many special needs assistants, and I think the special needs assistants have the opportunity to have the greatest impact on a child with special needs, and I've seen that time and again, and I think I welcome very much in the programme for government a commitment to continue to extend and increase the number of special needs assistants within our schools, both mainstream and special schools. A number of people have mentioned the CDNT teams, and I suppose while we're all frustrated with the lack of services being provided through the teams at the moment, I think there is something about the model which we should try and build on. The model, of course, is not unidisciplinary. It provides multidisciplinary support to all the children within the team, and I think if we can build on that model and properly resourced with the appropriate personnel, we could have a successful model for the support and for the therapeutic intervention for children with special needs. But just to give some, I suppose, insight into, how the numbers can be different across the CDNT teams. In County Galway, there are 6 CDNT teams. In one of those teams, as of last March, I asked this question at the Regional Health Forum, there were no children waiting for the initial assessment, which I thought was very noteworthy. And I sought to get further information as to what was the case. And sure enough, when I looked at the staffing cohort of the 6 teams, the team that had no children waiting for initial assessment was the best staffed. It had the highest number of speech and language therapists, the highest number of occupational therapists, psychologists, all the way down to social workers, preschool liaison and other support. And I think there lies the problem and the answer.